One, what's happening, YouTube? You're back in the building on the Larry and Lamont Show, your Black Avengers of Current Culture. Today's guest is a world-renowned doctor. She went to my high school. We're going to call her the First Lady of Psychiatrists. Her name is Maria Trent. Maria, how are you doing?
I'm doing great. How are you, gentlemen?
Oh, we are golden.
We are good.
I'm living my pandemic life.
Oh, God. Here we go. Here we go. So, for those of you that don't know, COVID-19 has increased drinking, drug use, and a whole lot of other things that can take over your life if you don't watch it.
That is so true.
Right. Which also leads to mental health. So I thought it was just apropos to bring her on to talk about mental health in all communities, but especially in minority communities, because we're getting hit with COVID-19 the worst. But before we do that, Maria, whenever we bring a first lady of anything on this show, we got a highlight package for you, just like you, Michael Jordan. We got a highlight reel.
Here we go.
Here we go. DJ, hit that highlight package. It's number 2.
I am Dr. Maria Trent, your double board certified child, adolescent, and adult psychiatrist based out of Annapolis, Maryland, representing my private practice.
So not only is she an MD, but she's very physically fit. That's her doing a handstand. And take a look at this deadlift. Good gracious sake. And then she gets back into it again.
Breathe.
Wow. Good. Ladies and gentlemen, that's more than what I weigh. Then she's down there doing elevated push-ups. Then she's doing toe-to-bar push-ups. I mean, my goodness. When you talk about an MD living the lifestyle that they preach, not only does she live the mental aspect, but she also gets it in the physical aspect. And you guys are getting ready to learn a whole lot from this young lady. Be sure to follow her on Instagram. Her links are in the video description, as well as the pinned post. And how can we do a highlight reel without ending on a good note for those of you that are wondering? Because I know some of y'all fellas is out there wondering, hands off. You can't do nothing.
Woo, man. I'm about to ready to go have a kid and make my kid crazy just so I can see her once a week.
Too bad, brother, too bad. So Maria, as I mentioned, me and you went to high school. You was a couple of grades higher than me. Very smart. You was gifted. You went to the School of Science and Math. Was that when you made the decision you wanted to become a doctor?
I had actually made it before then. So my mother and father are both in the medical profession. My mom's a registered nurse. My dad's a family physician. And so I've seen it all throughout, growing up. And so I've seen how they, made such a difference in so many people's lives, and they loved helping people. And I was often in my dad's office. I was often in the hospital with my mom at times when she had shifts. So I just grew up thinking, that's what I want to do. I want to do the same. I want to help people. So
wow. And where did you go to your advanced degree schools?
Okay, so for undergrad, I went to Yale University.
What? I gotta go.
We don't play down here, Larry. We do not play in North Carolina.
My wife has already told me I can't talk to anybody who went to Yale or Harvard, so I have to go.
Oh, I got lucky too. It's all good. It's all good.
I love it. Part of the Holy Trinity. All right.
Awesome. Yes. So for medical school, I came back home to North Carolina. So University of North Carolina School of Medicine. And then from there, I went to Baltimore. So University of Maryland Medical Center. At the time, I was married. So couples matched into psychiatry at University of Maryland. Was there for adult psychiatry, and then did a fellowship there as well for child psychiatry.
So you put it all on the line, and I've had to live the fellowship life in this house.
Yeah,
folks, you don't make a lot of money in the fellowship life. I'm talking, it's nothing, but they work your finger to the bone.
They make you earn it. That's for sure.
Yeah, they gonna make you get it. And so you went through that hardship, and then you decide you want to go in business for yourself. Tell us a little bit about that journey.
Absolutely. So, mental health treatment and enlightening, especially our communities of color, about the importance of support, treatment, even identifying what mental illness is, if they have any, and then just not being afraid to seek out treatment has always been really important to me. And so I've been fortunate enough to be able to reach a lot of people in different capacities through clinics that I've worked at. So outpatient mental health clinics. I worked in one in Laurel. I still work at one in Landover. But I said, while I'm blessing people through these clinics, I would like to also have my own and be able to have, a deeper connection and be able to spend more time with people and help them not only with psychiatry, but also with therapy as well. So I really wanted to start my own private practice. So my private practice is in Annapolis, Maryland, Elite Excellence Psychiatry. It's been open for almost 2 years now. And it's going very well. So definitely it's a beautiful thing to be able to reach so many different communities, different types of people, and to, again, just spread more awareness of mental health, illness, and treatment and try to erase this.
How did you find your way to psychiatry? Because I know that there is a national shortage of psychiatrists and a national shortage of psychiatrists for people of color. And so, I'm curious how you found your way into that specialty.
Absolutely. Absolutely. So the thing is, when you're in medical school, the possibilities are wide open. Nobody really knows what they want to go into. They may have ideas, but as you go through the different rotations, you get to get a taste of what the different specialties are like and the people, your colleagues, your potential colleagues, how they will be in their personalities. So you get a feel for what you can tolerate, what you can't, and all that good stuff. So initially, I really was thinking about doing surgery. I was going to do plastic surgery to kind of help people. And it had still a mental health bent to it because I was really concerned about people with like body dysmorphic disorder and people who unfortunately were falling prey to wanting to alter their body so much, that they were undergoing too many plastic surgeries. I wanted to try to intervene there and say, hey, I want you to love yourself for who you are. You don't need to do all this plastic surgery, or really try to help more with people who needed it to restore a sense of wholeness and kind of normalcy. So not so much, the cosmetic, but more so trying to really help people that need that to be normal, feel normal.
Cool.
Wow.
Yeah.
Well said. Very profound.
Yeah.
So,
however, I'm sorry, I didn't get a chance to shift.
No, you go ahead.
So basically what happened is I had encountered a dear friend that had serious mental illness in his family. And so I really got curious about psychiatry. And as far as I knew at the time, a lot of schizophrenia and serious mental illness I only knew about it from TV. So people were kind of really severely mentally ill. You'd see movies about it and like, okay, well, is that real? So I decided I wanted to do rotations at Dorothea Dix. So, a state mental health hospital in North Carolina. I said, I want to see the real deal. I want to see what it's about. And when I got there, I was shocked. It was real, and people were really suffering. And I said, this is a population that really needs help. And a lot of them, unfortunately, were people of color. And I said, I want to get in there. I want to make a difference. I want to, diagnose and figure out what it is that's going on and truly give them the treatment that they need, not just medicines, but also, hey, brother, hey, sister, you're not alone in this. I see you. We can get through this together. We can figure out how not only to help you, but to help the family. Because again, it's not just a solitary, isolated disease. Often it can run in families. But also, just like you said, to try to decrease the stigma of mental illness in the Black community in general and communities of color.
So in your practice, go ahead, Lamont, I'm sorry.
I was just going to ask her, you can ask her to practice because the question I'm going to ask kind of deals with the stigma of mental health. So I'll let you go first, Larry.
So I was curious about, in your practice, do you get an opportunity to actually provide much therapy? Because I know things probably have changed it's been a while, but I know back in the day, like I'm a photographer and a filmmaker, and I was a photographer primarily for most of my life. And then after 9/11, a lot of my business just went kaput because a lot of my clients right out of New York and the whole music industry and all that stuff shut down for a long time. And I ended up taking a job of all places at Pacific Care Behavioral Health as basically as a person who answered the phone and helped direct people to their, to psychiatrists and MFTs or whatever else, wherever they needed to go. Mm-hmm. But one thing that became really apparent while I was there is that people who were looking for psychiatrists that actually did therapy, they could not find them. Most of the psychiatrists were so overwhelmed because there were such shortages that all they did were medication management visits. They would come in, see people for 15 minutes, say, how are your meds going? How do you feel? Any reactions, any side effects, yada, yada, yada. They'd write them a new script and send them on their way. And that was it. And so I'm curious, as a psychiatrist, do you have an opportunity to do therapy with your patients, or do you find yourself so so overwhelmed that all you really have time for is managing people's medications?
That's a great question. So that's huge in the psychiatric world right now. A lot of psychiatrists like to do therapy, but the business side of medicine, whether it be the clinic owners or hospitals or whoever, you're right, they pay us to be productive, to get people in and out. However, psychiatry is one of those fields where you can't just, you take that, you take that, you take that. You really need to sit and listen to the patient. And so for those of us who really value quality of work over quantity and don't care so much about, the money, it's really about taking your time, listening to people, seeing the whole picture, not just, okay, you're hearing voices. Okay, you automatically got this. You need to take this medicine. No, it's like, okay, well, what's the stress that you're under? Under what circumstances are you hearing voices or feeling depressed? Or what's the family dynamic? What's your family history? It's important to get all of that information to see the person as a whole. And then not only just throw medicine at them, but to say, hey, we may not even need medicine first. Let's take a step back. Do you have good coping skills? Do you have a good support system? Are you eating right? Are you exercising? Are you doing things that's going to improve your mental health just from a holistic standpoint? And then if all those things are not working for you, then let's look at other alternative treatments, because again, you want to, as a physician, you do no harm. So you want to do, the least invasive treatment or the treatment that will cause the least amount of side effects or harm. So again, I'm truly a proponent of therapy. I do interject that into my meetings. So what I do in terms of from the business standpoint, I push back a little bit. So when I'm working for a clinic, they'll tell me, yeah, we want you to see people in 15 minutes. I'm like, at least 30 minutes. I need time with my people. So this surprises them a little bit. They're like, oh, wait a minute, but we need productivity. We need money coming in. If you're going to spend that much time, But I tell them, I said, well, I guarantee you the extra time that I'm spending with the patient, they're going to get better. They're going to keep coming back to stay better. It's going to reflect positively on your clinic and essentially help more people. So if we slow down and give quality care as opposed to just trying to earn a quick buck, then it'll work out better for all of us. And then also for me, that's why I opened my private practice. I can spend as much time with my patients as I want to, because I do believe in taking the time and, going the extra mile. And, it's important. They want to know that they're not just a symptom. They want to know they're not just a diagnosis. They're not just a number. They're not just a name. They're not just someone that you're just throwing medicine at. They want to know that you are listening, that you care, and that you are looking at them as a whole being. So.
Cool. All right. I see you.
We see you, player. We see you. So now I've got to ask the tough question.
What's that?
There has been traditionally a stigma in minority communities about seeking mental health. What have you been able to do to subdue this mindset, and what would be your advice to people to overcome that? Because, I was taught from a male grandfather that if you're having problems, you don't go talk to people, versus my grandma who was like, yeah, you yap your mouth to somebody when you have a problem. You don't hold it in and try to deal with it. So how have you been able to overcome that stigma that's in our community, especially in a time like right now?
Right. So you're right. This problem runs deep, and it goes to just cultural values, men feeling like they have to be strong and hold it together, can't show any weakness, can't let people know there's an issue. Same for the image of a strong Black woman who has the whole family down. You can't be weak. You can't, not hold it together. Or even just with like the Tuskegee experiments, Black people that did go in for help, they were essentially betrayed, told they were getting treatment, weren't. They were actually being infected with, syphilis and whatnot. So there's a lot of distrust in the medical community, especially when people of color seek out treatment. So they don't want to. Even now, I think with the whole COVID, 19, the talk of vaccines, people of color like, we're not getting that. I don't know what y'all doing.
No, I feel you on that one. I've been like, I don't think I want to go in the first round.
Yeah,
but I think I might wait until, we'll find out what everybody else gets. What if they start growing third arms and whatnot?
Hey, sign me up. I'm ready to become a mutant. Let me get them Power Storm guy. Let me become Bobby the Iceman. Hey, stick me all up, whatever you want to do. But
oh my goodness.
On some serious note though, when COVID first started, now we got to do better in this minority community now, because in the beginning we were saying because we lived somewhere that had a dirty creek, Black folks couldn't get COVID-19. And now that we're the ones who are affected the most, we're really in here talking about we don't want to get a vaccine.
Okay, so you bringing up a perfect point. Education. We got to educate our brothers and sisters about scientific facts. You know what I'm saying? So that's a huge part of what I believe in. I believe in educating people. So a lot of times people of color, especially when they seek out mental health treatment, are prematurely diagnosed or given kind of worst case diagnoses, like they're more likely to be diagnosed with severe things like schizophrenia, bipolar, when that may not be the case. A lot of times we're not taking into account traumas. We're not taking into account, difficult living situations, lack of support, lack of resources, etc. And we jump to the worst case scenario. So education, I think, is huge in our community. And I think it helps seeing people that look like you, going to people that look like you, I can relate. I understand, I've been through some things. I understand how culturally we tend to deal with things, how the family dynamic works, some things that we struggle with, even, with our Black men being shot on a regular basis for nothing.
Right.
For jogging.
Yes. I have, a Black fiance. I have a Black son. I feel your pain, literally. So I think it helps when people can see someone that looks like them, that can relate to them, educate them about, true symptoms of mental illness and treatment, and really what are the risks as well as the benefits, because people will be quick to tell you, take this, but they don't know what the side effects potentially could be. And so I totally believe in, we're in this together, making a decision about your treatment. I'm going to let you know all that you need to know so we both can come to a conclusion. And if something that I've recommended, my professional recommendation, doesn't seem to be working with you, I'm listening. That's why I'm taking the full 30 minutes with you to hear, okay, so what's your experience been? Is it working for you? Is it not? If not, let's figure out how we can adjust it together. So I think that's really huge. And then again, just laying out all the options on the table, not just medicine, it's therapy, it's support, it's cognitive behavioral therapy, or different things that we can do to try to just help people as a whole.
So how do we make getting help trendy again? I feel like there was a period of time where Black folks were feeling like, oh, it's cool and trendy to say I'm in therapy. It was almost like a status symbol to say I can afford to get mental health. I can afford to actually say I'm in therapy and going to see someone for something else besides a broken arm or a cancer or something. That they were actually, it seemed as if it was almost like they were saying, I'm bougie now because look, I'm getting therapy. And I feel like if we get back, I thought it was a good thing. For whatever reason, because I feel like there's a lot of people out there that really need therapy. And if whatever reason, if they feel bougie to go get it. But how do we get back there? Because I feel like that's sort of gone. And now we're just back to the way things were before, where you're looked at as weak or can't handle your own stuff or whatever if you need to get help.
Okay. So I feel like we need to stop worrying about what everybody else thinks. Stop trying to stunt. And really just focus on being better ourselves, if not for ourselves and for our children, for our communities, and for people who are looking up to us. So it really has to be more about just trying to improve yourself. And if it's breaking generational cycles, if it's breaking patterns in family, if it's trying to be better for your mate, better for your children, better for whoever, people really need to start looking within and saying, hey, I'm struggling with this. Or, there was abuse in my family that I need to get over that no one's talking to me about. And, cousin so-and-so, he's hearing voices and stuff and no one's saying anything about it. They're just kind of sweeping it under the rug. Like, we need to talk about it and try to heal and get the tools that we need to deal with all the stress that we have been through and that we'll continue to go through. So it can't be trendy. It has to be, we truly want to improve ourselves.
One thing that I think would make a difference, and I always tell my wife this, because we have such a mistrust of the medical field as minorities. One thing I seen when I did my respiratory outpatient for 10 years was physicians would bring me in to go see their patients that had lung problems in their home that they couldn't break through to, and they didn't understand why. They would tell me what therapy modality they wanted to put in place, and for whatever the reason, I would go and sit with these people and get it to work. There should be a field that's like a transition between maybe you're not a respiratory therapist or a doctor, but you can translate what the doctor's saying to minorities and be a minority or something to that effect.
Yes.
Because I had
Well,
yeah.
I was just talking to my wife tonight that Nancy Pelosi is, I guess they're trying to pass in this next bill, trying to establish some sort of national medical corps, health corps. And I think that maybe part of that could be outreach to communities that are underserved or untrusting or whatever else. And when you have people like you who have already worked in the medical field, or Dr. Trent, who's obviously a doctor in the medical field. I mean, I'm not that you may want to work for the government, but if you have people that can actually go out that look like you and say, hey, let's sit down and talk. Yeah, I know you don't trust that white dude over there. Might be looking at him crazy too, but let's sit down and just talk. We'll chop it up. We'll leave him outside sitting in the van. I mean, that could,
Look at you. See, you could turn a good medical conversation into Scooby-Doo in his van. You talking about leaving this guy outside like he's Shaggy on Scooby-Doo with the dog. We was doing good, Larry. Here you go. So see, this is why I'm here, Maria, because I have to rein us back in sometimes. Larry's like the high tide, and I'm the low tide. He goes high, I bring us back in.
Hey, there you go.
Exactly. So now what I want to know is, you mentioned we need to educate ourselves. So on this particular avenue, other than your website, which is listed in the video description, where are some good trusted places people can get more information about mental health?
So mental health. Okay. So, I mean, definitely, just the trusted national websites in general. So I know the CHADD website, CHADD.com, is really good on childhood, like ADHD. I mean, it doesn't hurt to go to CDC. It doesn't hurt to go to, give me a second. Psychology Today actually has some pretty good articles as well. There's quite a few, but again, you want to go to trusted resources. So definitely the government will put out some national ones that are really helpful, but you don't want to just trust Google. There's Dr. Google out there, and people often will come to me and say, but the internet said this. As even with us as medical professionals, even when we get scientific articles, you still appraise them critically. You still question, okay, well, who was sponsoring the research? What were they trying to prove? Were there confounding factors, things that may have interfered with the outcome? So, I mean, all of the information that you gather, still look at it critically, but, have your questions, bring them to your physician or your healthcare professional.
So I'll tell you something that'll make you smile. My mentor that motivated me to go to college, become a respiratory therapist, start my own practice, she taught me how to do the coding for my business, is a clinical psychologist.
Really?
Yep. And she was my college psychologist. And to this day, she's still a dear friend of this family. We actually went and saw her when we first got pregnant. And so if it wouldn't been for that woman, God knows I'd be a lost soul right now. Somewhere you would see me on Instagram dancing in two pieces and stuff like that. I was in a lost cause. Call me DJ Mont, shake it up.
Okay. Too funny. Awesome.
All right, Doc. So let me ask you this. So how do we get to what's some advice that you can give people? And I don't want you to give medical advice, but when people are dealing with folks that are having, Black people in particular, that have family members that are dealing with their family members that are having episodes, because one of the issues that we've had in the Black community is that we've had family members that have mental health episodes, and we are afraid to call 911 because we have seen where you call 911 and the next thing you know, your family member is dead and shot 19 times laying in the street. And I mean, we've seen episodes where Black people who are, and it comes to my mind where I see that Black guy who was a therapist, I believe, that was working with mentally disabled and physically disabled and mentally disabled patients. And he was out there trying to help his patient and got shot. I mean, the dude had his hands up so what do you tell your patient's family members or someone that said to say this is what you can do to help if they're having an episode, because there are a lot of people that are just simply afraid for their family members' lives and won't call for help because they know there is a very real threat that if that person's having an episode, they could be killed.
You're right. That makes it very difficult. So, I mean, it depends on what the crisis is. Normally, we don't try to involve the police unless someone's suicidal, homicidal, or so psychotic that they're putting themselves at risk or someone else at risk of harm. There are crisis hotlines you can call. There are suicide hotlines you can call. There are crisis response teams that you also could call. And again, these are trained professionals who can try to help and intervene and come to the home, or even talk someone down, via phone or some other means, so that you don't have to necessarily get the authorities involved. Also, just again, educating the family on how to try to de-escalate situations in which families may kind of be agitated or belligerent is also helpful. So sometimes just letting them know, give them a little space, give them a chance to calm down, have some things in place that they can use to help them cope with the situation. So for kids, for instance, if it's coloring, if it's drawing, if it's music, if it's giving them, just space in their room just to be, teach them that. If it's breathing exercises, if it's mindfulness techniques, if it's whatever, try to equip the families with ways to help their family members cope. And then also, if it's a family member that is taking medication, having them in a gentle way, helping their family remain compliant with their medication management. But definitely, I agree with you when it comes to emergencies. So someone's safety being at risk, then we do have to kind of gently figure out how to, one, keep them safe, number one, but two, navigate with the authorities. How do we make sure that my family member, you're right, is not going to be shot dead on site?
Right.
It's really tough. But I think also what's important is for mental health professionals to be having discussions and educational sessions with the authorities too. So that's one thing I've really been thinking about, is trying to approach police departments and try to give seminars on, how to recognize when someone is mentally ill versus just, not caring and just going at you in a kind of more criminal way, and how to de-escalate the situation so it doesn't get to the point where a fatality occurs.
Right.
I'm going to ask you one more question about the mental health industry, and then we'll careen you to the other passions that you got going on that do tie to mental health. What would be your advice to those who are just, were just having a hard time with the restrictions and the shutdowns dealing with COVID-19? What is the way for them to, liberate their mind and liberate their mentality?
Okay, that's a great question. And that's something that I feel like we're all trying to figure out, you know what I'm saying? Because all of us are being affected, not just those with mental illness, but it's kind of a situation in which we're to some degree having to adjust to a new normal, or even mourning our old lives, or trying to figure out, well, where do we go from here? Because right now we're not sure when this is going to end, if it will end, you know what I'm saying? So you're right. So what it takes is trying to maintain as much a sense of normalcy, like your normalcy, as possible. So if you normally go out with friends, stay connected. If it's, virtual happy hours, virtual sipping paints, virtual chats, meetings, or whatever, it's important to stay connected. And also, even within your household, if you guys can be gentle with one another, be supportive of one another, understand that everyone is responding to this in their own different way, and trying not to let tensions rise and get snappy and on each other, which can be hard, but just trying to deal with each other gently, realizing that we're all trying to make the best of this situation or cope the best we can. I think also, eating right if you can, which has been tough because folks are right by the kitchen, they grabbing everything, myself included.
I have a thing of M&Ms that's like that big, and I ate one of them and I ordered two more. I re-upped and I was like, this is out of control.
Man. I haven't seen my last ab disappeared 4 weeks ago.
Who you telling? Well, that's why I'm like dancing and everything, trying to get it back. You know what I'm saying? So.
Oh man, I haven't seen an ab since I was 16. I don't think. No.
Hey man, well you ain't missing nothing. I seen them earlier this year, and I'm sad to see them go. So if you ain't seen them that long,
I have great abs. They're just all on my wife.
Oh
so.
yeah.
There you go. There you go.
So, but Maria, there's one question you didn't answer, because now I'm not speaking for me, I'm not speaking for Larry, but there are a whole lot of folks who got jumped off out there somewhere, and they're frustrated because they can't get to them. What are they supposed to be doing? I'm speaking for the people on the streets.
You know,
funny. Oh
how do the side chicks deal with their loneliness?
Yeah, what are they supposed to do? I mean, these people are having crises and breakdowns.
You're right.
Side chicks need love too.
Yep, and we ain't talking about rubber men either.
Okay. Well, see, I was about to say they have to relate to themselves, but you know.
Okay, we're getting off this rant right now, Larry. We're getting off this rant. This part of the conversation is over. Maria, you have merged mental health with physical fitness. Tell us about what you're doing with Instagram and how that's impacted your overall picture of wellness.
Okay, definitely. So physical fitness, physical activity has always been a part of my life. So when I was younger, I was in gymnastics, I did taekwondo, I did track. I did a lot of different activities. And so just naturally for me, being an athlete and continuing that type of lifestyle is important. And it's something that I, even just feel is a good stress reliever for me. Mm-hmm. So what you said earlier is also applicable. So I'm a physician. Physicians really try to encourage health and overall health, and health is wealth, like you said. But I truly believe you can't preach it if you're not practicing it. So for me, I want to be fit. I want to be mentally healthy. I want to be spiritually healthy. I want to have a good support system. I'm eating right, doing all these things that I'm preaching, because I can't not do it, but I'm telling you to do it and expect you to do it. So it's really important to me to maintain a balanced and healthy lifestyle and to try to be a good example of what I'm preaching.
Your president do it every day. I mean, he's always telling us what to do and he ain't doing it. I'm just saying.
Okay, you just gonna put him on me like that?
Okay, no, not you. I was talking to Larry.
Yeah, he's yours. You know how us black people do. When there's something we don't want, it's yours. That's
Absolutely.
your daughter, your president, your mama.
But both of y'all will take Obama, right? Y'all both take Obama and stick me with President Trump, right? That's
so those your words. Yeah, definitely.
But which President Obama are you talking about? Because we might have another one if Biden plays his cards right.
Wouldn't that be awesome? Wouldn't that be awesome?
He better.
That would be.
He better, because that is the motivation that could turn around this whole nation if she jumped on that vice president ticket.
I don't think she's going to want to put her family back through all that again, though.
Look,
she has a responsibility.
And she does.
You know what? You have a responsibility to this nation at this point.
Matter of fact, Maria, just for you, we forgot to give you the Life Gain opening applause. So let us give it to you right now. There you go. There you go. And so you've been growing the Instagram. Do you feel like you've been able to make an impact for people in terms of their physical fitness with your Instagram so far since you've been doing it?
I truly hope so. So let me just even say how the videos came to be. So I definitely, like I said, have been working out on a regular basis, but I had started posting videos of workouts with the hopes of trying to inspire at least one person to say, hey, I want to take better care of myself, and I see somebody else doing it, I can do it too, And so it also happened when I had joined. It's funny, I know you told me that your wife has done competitions, bodybuilding competitions, and someone has suggested to me, well, you're doing all this working out, why don't you get in a competition of some sort? And I said, I don't know, but it happened. It was one specifically for physicians. So it was called Fit Docs competition. And so it was about 2 years ago. I said, okay, what the hey, let me go ahead and give it a try. And part of their requirement was to post one video per week of a workout. And again, with the hopes of inspiring people by seeing physicians who are taking better care of their health and taking charge of their health to do the same. So that was where it started. And I kept it going, even though the competition never came into fruition. Apparently there wasn't enough funding or something happened it got postponed or whatever. But I was like, you know what? This has changed my life for the better. I'm as fit as I've been. Well, not now, but I was as fit as I was, had been for a while. It was fun. It was motivating me as well, because I was like, okay, well, what workout? I want to do something new each week. What new workout am I going to post for people to get them encouraged and motivated to take better care of themselves? So I love it.
No
cool.
doubt.
All right.
Now that we've gotten all that out the way, now it's time for the fun stuff, because you are a human being on top of all the stuff you've just mentioned.
Absolutely.
So, doctors are human beings? When did that happen?
They're human. They're not robots. Hey.
I'm surprised she's even at home. I thought doctors lived in the office.
Hey, home is the new office now, Larry.
Yes, it is. Home is
COVID-19,
right?
Psychiatry, absolutely.
There's some Zoom therapy going on.
Exactly. We do a lot of TV and movie reviews on this channel. Larry does a lot of tech reviews. We both have done some of those.
Okay.
What are two of your favorite TV shows, and then accompany that with favorite movies?
Oh gosh. Okay. So I'm gonna be honest with y'all. I don't watch a lot of TV because I'm busy.
What? You don't watch Married to Medicine?
No, I'm a mother of two. I'm on private practice, trying to keep the fitness thing going, engaged, wedding coming up in August,
Hey, congrats.
Thank you. Take care of it. But I try to squeeze in a show or two. Lately, what have I been watching? I've been watching Blackish. I really like the positive, African-American family.
Loving it.
And the family values. Let me see what else. What's the last thing I watched other than Blackish? I think I watched Chicago PD.
Okay.
Really?
All right.
Okay.
All right.
So give us some movies you enjoy.
Okay, movies that I enjoy. Let's see.
One Flew Over the Cuckoo's Nest.
Oh, okay. I do like psychological films. I like action. Let's see. I'm trying to think of specific ones. Give me a second. One I just watched with the kids not too long ago was Bad Boys.
Bad Boys. That was good.
That was good.
On TV recently, I saw Silence of the Lambs again. That's an all-time favorite. Yeah.
Man, talking about some craziness going on.
Boy.
Oh man.
I don't think after that I watched that movie, I was like, I don't ever want to have Chianti.
I know, right?
Boy.
I like I like Django. I like all kind of movies. I like Denzel movies. Yeah.
Are you into the Marvel mania at all?
A little bit. I will definitely catch it.
I know Little Man got to be into it.
Little Man's into it. My fiance's into it. So when they want to see it, I go with them. Absolutely.
All right.
Okay.
Absolutely.
Okay.
Now
here's going to be the most intense question I've asked you the whole time.
Okay.
If Married to Medicine, any county in the whole United States came to you, would you get on the show?
Woo! Oh my goodness.
So you got Atlanta, you got LA, and I heard Andy's thinking about putting one in New York.
Really?
Well, let me say this. I went to American here in DC and got my master's in film and video production. And one of my classmates that was in my cohort is one of the producers for Married with Medicine. She's out in LA. So I don't know. Maybe I'll have to see if I can drop her a message and say, hey, I have this nice Yale educated doctor that's attractive, fitness model. I was like, maybe you just ought to go ahead and check her out.
Oh my goodness. That is a
psychiatrist, so she can head shrink all the rest of those crazy chicks when she gets on there.
Oh my goodness.
They're all crazy. You have to be crazy to be on a reality show.
There's a lot of drama, but I feel like that's what reality show requires. They want ratings.
It really does.
The people coming back. So
I told my wife, right? Make sure she can't hear me. I told my wife, I was like, yo, honey, if we get on the show, I can play the Kirk to you being Rashida. And the difference is I can make it with an Anglo-Saxon. And she looked at me and was like, no amount of money.
Right.
For no amount of money. Are we going to get up there and let you be buffooning around? She said, for no amount of money. So I'm out. So all I got left is you. So
don't be the Kurt. Be the Todd to her Candy.
That's not enough drama. That ain't enough drama.
I think it's so much drama that would just shine a negative light on, and it's
it really does.
Yeah, you're right.
Maybe they should have a new one. They should have a whole new show with psychiatrists, and they can call it Head Doctors.
That would be awesome.
But here's the problem. Here's the problem that we have, even as YouTubers. When you put out positive content, you don't get the views. That's the issue.
True.
And if you're not doing nothing crazy in your show, if you're just putting out positive, insightful information, it don't matter how hot you are. If you're not doing something crazy, they're not tuning in.
Well, she can come up with a new therapy that mixes her workout stuff with dance. You can call it Twerk Therapy, and then you can have all kinds of people coming in. Not only will you have this thing that people come for, you can do like with Zumba It's
This
just a whole
guy.
thing. It's called Twerk Therapy, where you get your
Boy.
psychiatric treatment
Wow.
and your workout all at the same time.
Lord.
Okay.
It's like group therapy in a workout class.
Too funny. Would you let your wives support?
Huh?
Would you let your wives participate in support?
Oh, absolutely. If my wife comes back mentally healthy and twerking, I'm all for it.
Hey, look, it ain't gonna be but so much twerking. My wife is 8 months pregnant, so her twerk might be a little jerk. You know? I mean, ain't but so much we could do in that regard.
She might want to go to that class after she has the baby. She might be like, "This is my way around postpartum. You know, I'm gonna go twerk my way past postpartum."
Oh my goodness.
If it worked. All right, Maria. Now we're officially on the off ramp. All we want to know from you now is, what are your goals over the next 5 years?
That's a great question. So goals of the next 5 years, definitely I want to grow my private practice so that I can, again, reach more people, not just people of color, but all people, and just, again, bring to light the importance of mental health identification, treatment, just healthy lifestyle, and just educating the communities on how to better deal with it. I'm also looking to write some books as well. So I've already written actually 2 children's books, which I'm working on illustrating and kind of getting out now. But my goal with that is to really try to help impart wisdom to parents on how to raise resilient children that can deal with anything. And so a lot of times, not just telling them what they need to do, but modeling for them and giving them the language to use and examples, you know, to try to empower them and build their self-esteem so they can deal with whatever's coming. Eventually, too, I will work on some books specifically for adults as well, you know, specifically for our community to better deal with mental illness too. But I'm also looking to expand in terms of coaching and consulting as well.
Nice.
Wow.
All right.
Well,
All right.
ladies and gentlemen, me and Larry, we're here for all of it. As a matter of fact, we encourage you all to be here for all of it. All her links are in the video description, as well as the pinned post in the first comment. And speaking of a children's book, if you want to give my child a one-on-one session, we can ship L's little butt right over there to be in your class for a whole week while me and my wife take a little vacation and rekindle some things. So if that's something you want to do, hey, she can get that firsthand education. She don't even need the book. She's going to have the author of the book right there.
Bring the baby.
There you go.
No
We're
way.
gonna have all kinds of stuff for you. You're gonna have your children's book thing that you have going. We're gonna go rent a studio, and we're gonna turn the temperature up to like 125 degrees, and we're gonna have hot twerk therapy for you. What else do we say? We're gonna have all kinds of stuff going. We're gonna promote it all for you.
And then after she's done with the hot twerk and they done sweated off all their makeup, she can have a makeup session.
There you go. There you go.
We give you 4 streams of revenue right there.
There you go. See?
So it has been a lot of fun. We hope you all have enjoyed this and learned a lot. She is your resident psychiatric, Maria Trent, MD.
Thank you so much for having me, guys. It's been fun.
That has been fun, man. I feel like you need to come back every now and then, especially after whenever there's a BTSD thing.
I would love to.
Or a major crisis in the United States. Like, we would have loved to have had you up here when R. Kelly was having that fallout.
Oh my
goodness. And not to mention, he was having a fallout. Now the chicks that he was with, that's not with him no more because he's in jail, they're having fallout. So life comes at you fast.
It does.
These are things you could definitely cover on your YouTube channel, because who needs TV when you got life?
You know, let me ask you, since we have you here, I was told, and I'm not sure if this is one of those codes in your medical book, but I was told there's some sort of condition or syndrome that causes people to be attracted to folks like R. Kelly that are basically just, you know, not just R. Kelly types, but people who are often in trouble, people who like people that are in prison, people who are always doing wrong. It just seems like, why are you attracted to someone that you know is
a bad boy?
Is a bad individual?
You know what? Sometimes it has to do with self-esteem. or lack of it. And so, you know, either feeling like they can't do better, or feeling like they don't have enough on their own, that they need someone else's excitement or status or drama, or maybe even has to do with being raised in maybe a dysfunctional home, or just being used to dysfunction and choosing to continue to stay in and operate within that. There's a lot to it. There's a lot to it.
Wow.
So,
all right.
Well, we'll
Do you have
save that for
any, do you have
another
any
day.
crazy stories that you can share from your olden days, your residencies, or anything that something that was
I
funny
have
or whatever?
two, but they may not be appropriate because they're crazy.
Oh Lord. We'll save that for another day. Y'all,
Another day.
don't forget to like this video, comment, subscribe to Larry. Go check out Maria.
Maria,
Do it
you see
all.
how he is? He brings this beautiful, intelligent doctor on here, and he wants to cut me short.
Yeah, we got it, man, because I done told y'all, he's high tide, I'm low tide. So the word of the day, ladies and gentlemen, the closing word is overcome the mental health issues and stigmas you may have.
Definitely.
Seek out some help. More importantly, check out Maria Trent. And
Thank
that's
you.
going to do it for this video. Don't forget to like the video, comment, subscribe, get yourself that life game. Me and Larry and T-Streams will be back tomorrow for the live at 9 o'clock. Until then, we'll see you.
Peace.
Have a good night.